I'm Joseph Herrera. I'm the chair for the Department of Rehabilitation and Human Performance for the Mount Sinai Health System.
Hi, I'm Saman Setareh. I'm cardiology fellow at Mount Sinai Heart.
How does COVID-19 affect the body, especially after recovery? So what we're seeing is a range of varying symptoms from a number of patients, everything from mild symptoms all the way to severe symptoms after being infected with COVID-19. And what we're seeing is that it affects the patients both physically and cognitively. So everything from increased fatigue, shortness of breath, tachycardia, difficulty concentrating, which some of our long haulers call brain fog. So there's a number of different symptoms that we see that affect a number of our patients. And some of our patients may have a few of those, a number of those, or all of those, depending on the severity of the symptoms. So what we've been advising patients is that if they're symptom-free, they can resume activity as tolerated. Now, this also depends on what their course has been. So if they've had a hospital course, for example, and they've been in an ICU bed for a prolonged period of time, we then usually work with them to make sure that they're returning to normal activity first, then to exercise. And what we usually use here is what we call the rule of tens, where if you were exercising, say, lifting 100 pounds prior to getting infected with COVID-19, we have the patient cut everything in half, or maybe even to a quarter to lift to, like, for example, 25 pounds. And then we apply the rule of tens, which is increasing either the intensity, the duration of exercise, 10% every 10 days, so that they have a gradual increase in activity.
Early on in the pandemic, as the initial wave of the patients were recovering from the first phase, we started noticing a lot of our patients are not able to go back to their baseline exercise level. They had trouble breathing, had dyspnea when they were exercising. They felt their heart were racing, felt palpitations, and at some point chest pain. And it became a good amount or a proportion of our patients that were affected by these symptoms. And as Dr. Herrera noted, COVID-19 affects the entire body, and it's one of those diseases that we've seen affects anywhere from no symptoms to mild symptoms to severe and to requiring hospitalizations and, in unfortunate cases, even death. So what we do in our centers, especially in our post-COVID center, we recommend, based on multiple guidelines by American College of Cardiology Task Force and the British Task Force as well, to return to exercise very gradually, step by step. Don't go back to where your baseline was. At least wait 7 to 10 days, and then slowly from there, take 2 weeks. After 2 weeks, go to the second phase and start slowly. So again, it's those rules of 10, as Dr. Herrera mentioned.
So I think what we're seeing, we've seen a number of marathon runners and professional athletes as well that have been impacted by COVID-19. And I would say that they, similar to the general population, have a range of symptoms, some very mild all the way to severe. So overall, I think that COVID-19, I don't think your pre-infection conditioning really prevents anything. But what we are seeing is that there are some athletes that do have severe symptoms and have more of the long haul symptoms that we've seen.
What we've seen in our athletes, COVID-19 doesn't discriminate between the athletes and non-athletes. I think that's an important message that has to go through, that even we have seen major effects, long hauler syndrome, post-COVID syndrome, in our very healthy and those who are athletes. However, mostly was mild and a lot of asymptomatic patients in that patient population. So in the professional athletes, there were multiple reports we've seen in the media that they were affected with myocarditis, their hearts had inflammation. But again, these are out of the thousands, out of the hundreds of athletes out there, we only hear about a few of these reports out there. And most recently, there was a data of almost 800 patients of professional athletes that only less than 1% had major cardiac inflammation or myocarditis. So long hauler or post-COVID syndrome, it's a series of, could again range from having shortness of breath, not being able to return back to their baseline level or where the pre-COVID level of activity, being affected by chest pain, palpitation, heart racing, cognitive or brain fog was being described. Over a few weeks after their acute or their acute symptoms of just cough and fevers had resolved. So we have seen 3 to 6 months or even longer people being affected by some of these symptoms. And physically, the decrease in activity makes them to be deconditioned. And Dr. Herrera, I think, can speak further on that.
Yes, no, most definitely. Our long haulers have symptoms that affect both the brain and the body, fatigue, palpitations, brain fog. And what we're seeing is that when these patients, sometimes they are not even hospitalized, these patients end up having difficulty progressing their activity. So as they feel like they're getting better, they'll have good days and bad days, and they'll try to push themselves, but instead of taking 2 steps forward, they take 10 steps back. So that's a common theme that we see with our long haulers. So a few different programs that we've put up here at Mount Sinai is our physical therapy program, which is a graded protocol. We rely on the patients monitoring the heart rate and other symptom trackers, such as grading their own exertion and making sure they don't exceed that. So they try to do activity at a submaximal threshold. We've seen some patients recover using this method and have increased back to, say, running, something as simple as running. So I think the message here is that if you're experiencing any of these long haul symptoms, don't push yourself, see a specialist, and get evaluated to see if you qualify for any of our different programs that we offer here at Sinai. I think that physical activity, everything from exercising, once you do your physical therapy, some breath work, we then progress you using the rule of tens, meaning that every 10 days we increase the intensity duration of the exercise by 10%, so that it does take some time. So we advise our patients that that your body needs some time to heal and rest. And that these symptoms resolve, but it does take a prolonged period of time for those symptoms to even get better.
So most of the data that we have on patients affected by COVID-19 who had asymptomatic infection or just mild symptoms on the heart, it was mostly on the athletes and on the pro athletes. So on the general population, we're learning more and more every day. And this is a new disease, and in the past year we have learned a lot. But especially in our long haulers or in our post-COVID population, we're seeing that they are experiencing heart racing, palpitation, sometimes new arrhythmias. But again, each patient is individualized, and we have to look at their heart in a manner that, is it something abnormal for them? Do they have chest pain, shortness of breath? And then at that point, they should be evaluated by a cardiologist to go under ultrasound of the heart, which is echocardiography, and electrocardiograms to see if there is any abnormal results. Then that could be then elevated or escalated to further testing. So for example, in our post-COVID cardiology clinic here at Mount Sinai, we do evaluate patients if they have any heart complaints or shortness of breath. We looked at them with different type of imaging, and then we evaluate them with exercise testing to see what's their maximal exercise capacity. Do they get any symptoms when they're trying to exercise on the treadmill? And does their heart goes under strain? That's not equivalent for their age group and their risk factors. So any patients, I think they're individualized depending on their risk factors and especially if they have cardiac history.
I think, especially if they have long haul symptoms, it's respecting these symptoms and understanding your body, creating a diary of what you're experiencing, and then working with our physical therapist, and then slowly working and gradual return to activity is the message here. You know, you can't rush this, because anytime you rush, or anytime our patients try to rush the process, they end up taking 10 steps back instead of 3 steps forward.
I would say, as Dr. Herrera said, respect the disease. COVID-19 comes with a lot of inflammation, and the body needs time to heal. So give yourself time, go slowly, gradually, and take your time to go back to your baseline. Slowly try to exercise in weeks period, 1 to 2 weeks, then go to the next level. First, starting to exercise with normal household stuff, even just walking and grocery shopping, that's weightlifting by itself. And then move on to exercising and pushing your exercise capacity.
So some of the return to sport guidelines, it varies depending on the governing body. We've been fortunate enough to work with a number of professional teams as well as our own national teams with regard to managing COVID and creating bubbles. On the local level, for children and games, sports such as soccer, t-ball, currently the recommendation is that children should be wearing masks when playing. Again, it may vary state to state and may vary from town to town. But overall, if a parent is anxious, then wearing a mask for your child would be suggested. Now, depending on the governing board of specific sports, they may require certain testing protocols as well as masking protocols. So wearing masks during competition, if there's no testing, is recommended. But as we're seeing with the NCAA tournaments going on, all of those athletes are being tested, so they are not wearing any masks while on the basketball court. So overall, listen to the guidance of the governing boards, your local town and state to see what's currently recommended, because each state has different varying degrees of COVID-19 infection rates.